Mariela Ortiz. I'm a respiratory care student, and today I will be going over trachea care kit. First, I'm going to start with my physician's orders. I have an order for a trachea care kit. I'm going to also identify my patient, looking at the medical record number, date of birth, and patient's name. I will gather all my necessary equipment, BBM, trachea care kit, and suction equipment as well. I'm going to go ahead and introduce myself to the patient. May I come in? Hi, my name is Mariela Ortiz. I'm a respiratory care student, and I'm here today to perform the trachea care kit. Is that okay with you? Then I'm going to go ahead and wash my hands. Using the alcohol hand sanitizer. I'll on my gloves. Sit my patient in a semi-collar's position. And I will go ahead and ask my patient to see if I can view his identification bracelet to make sure that the medical record number that I saw earlier in my chart matches my patient, and we know that this is the correct patient. So once I've done that, I'm going to go ahead and gather my equipment.
You'll also be helping me out throughout this demonstration.
Connected.
The first thing that we will do is we will verify the physician order for intubation. So once that's been verified,
I'm going to go ahead and check that our pressure is negative 100 and negative 120 for an abdomen.
Knock on the door.
I'm going to place this by the bed, preparing suctioning just in case patient requires some suctioning. I'll also be attaching our BBM
I'm going to wash my hands.
to the oxygen source.
I'll be washing my hands for exactly 15 to 30 seconds.
Placing it near the bed. So I'm going to go ahead and I'm going to take a baseline of vitals. I'm going to check respiratory rate, heart rate, pulse oximetry with my patient's saturation, and I'll also be listening to lung sound.
Partner is already sterile and washes hands.
Alright,
Once I have my gloves on, I will now verify my physicians I get first. My patients I get.
lung sounds on here. So then I'm going to come here and I'm going to open my trachea kit. This is going to be a sterile environment. So we'll open this. This is where I will keep everything sterile. Pour everything in here. And remove everything that's not sterile. It doesn't need to be sterile. Take it out of the sterile environment. So then I will grab the peroxide. Open, pour peroxide here. I will also be applying water in this peroxide, and I'll be adding water in this section here and in this section here. So we have two areas with fresh clean water. Move this out of the way. So then I will go ahead and I will apply my sterile gloves.
Every 6 to 8 seconds. And that everything's working by way of in the meanwhile, I'm going to have to ensure all my necessary work.
Move this out of the way. So the first thing I will do, I will start by removing the inner cannula. clogging it and dipping it into the peroxide solution in the meantime. So then I will go ahead and I will remove dirty gauze that the patient has. Then I will get a Q-tip, dip it in the peroxide, and clean the trachea flange with the peroxide. On it. Put this in the discarding area. Then I will get a gauze. And as well, dip it into the peroxide so that I clean the underneath portion of the skin.
And now my partner is ensuring breath sounds.
Discard it as well. With a clean Q-tip, I will dip it in water.
You will confirm to me that
And clean the flange with water, removing the peroxide that we had put on earlier.
because I do not have a camera,
I will do as well with the gauze. Cleaning with water, removing the peroxide, making sure that it's completely out because peroxide does irritate the skin. And then with a dry gauze, we're going to go ahead and dry the flange and the skin of the patient. Once we make sure it's completely dry, we'll go ahead and I will hold this and unhook this one. Holding it so that I don't lose the tree. As I'm holding it, I'll also apply the clean gauze. Secure it.
You hear that breath sounds are in the airways.
And then with the same strap, I'll hook it onto the old one so that I loop around it.
Is in a common position how I first enter the room.
And it's easier to cut through it.
My protective equipment. And this concludes our demonstration on how to intubate a patient.
I will unhook this one. Once again, I will loop it as well into the tracheal line. So then I will come and grab the inner canula, brush it, remove any secretion from the inner cannula that we unclotted, maybe the outside as well. Open it again, making sure that it's really clean. Then I will dip it in water, have it rinse. a little bit. And then dip it again. And then the other rinsing solution, which is water as well, making sure that it's peroxide, water, water. Once it's been cleaned, we'll go ahead and apply the inner cannula back into the trachea. And make sure it locks. And make sure it locks. So then, I will go ahead, remove my gloves, gather all my equipment to discard it. Remove my gloves. Discard the equipment. And I will reassess my patient's vitals, starting with respiratory rate, heart rate, checking pulse oximetry, and then I will also be listening to breath sounds.
Inflate it. Check the barrel.
Then I will ask my patient, is there anything that I can do for him? Place my patient back into a position of comfort. Turn off all the equipment. Then I would say goodbye to my patient and tell him that I'll come back and check on him later. Then I will go ahead and wash my hands. And then I'll get ready to go ahead and document in my respiratory care notes.